Hi there, you're watching Time Warner Cable's local edition. This is the Sacramento Report. I'm Jaime Garza, joined today by Assemblymember Anthony Portantino. Good to have you here.
Thanks, Jaime.
Today's subject deals with some medical issues and some very sensitive issues, in fact, and it's cancer treatment. And specifically, you're dealing or focusing on cancer treatment for young people, people in their fertile years, and yet there's some challenges facing these young men and women.
Yeah, absolutely. First of all, I was quite honored when the women's health community came to me and asked me to look into this issue. And when I found out that there were young women and young men who get diagnosed with cancer and then face the decision of getting chemotherapy and other treatments that might and most likely will render them infertile, many of them choose not to get their cancer treatment because they don't want to lose their fertility. And so they get sicker, they suffer unnecessarily, and their body's unnecessarily harmed by foregoing treatment to make them healthier. And then when we researched it farther, we found that just about every single consequence of cancer treatment is covered by insurance. For example, reconstructive surgery is covered after a woman has her cancer surgery, the reconstructive surgery is covered. But fertility protection, a consequence of the treatment, is currently not covered. So we look at that as a loophole in insurance coverage. Then working with some of the nonprofits who have done economic modeling, they've shown that the insurers will actually save money by preserving fertility and treating patients sooner who don't get sicker. And so it's good for the patient, it's good for the insurer, and certainly having the ability to preserve one's fertility is just a wonderful outcome of this. So that's what we're asking to be done. I've been surprised since we announced the bill how many people have come up to me, contacted me on Facebook, or sent me emails or called me and said, I face this situation, and you know, we couldn't afford to preserve our own eggs and our own reproductive ability.
We're talking about what, some $10,000, $20,000, something.
It depends
more,
on
depending on how you want to do that.
Right. Embryos are more expensive to preserve. Obviously, eggs and sperm are cheaper to preserve. The point is, though, that's a small investment with a small segment of the population that has tremendous health care benefits.
Have you been able to talk to some of the insurers and get
Yes.
their feedback on this?
We brought them in. I'm not the type of legislature to jam people, so we brought them in from the get-go to say, help us solve and close this loophole. We haven't gotten the feedback yet. We're hoping they see the merit behind this. We're hoping they see the economic benefit as well as the human benefit. Because imagine you're 25 years old, you just get married, you find out you have cancer, and all of a sudden, within a matter of a week, you're deciding whether you're going to lose your fertility or get cured. We've heard stories of women who have gone in and had double mastectomies, and then the doctor says, we're going to start your cancer treatment this week, and they say, no, now I'm going to get pregnant, and I'll start my cancer treatment after I have my baby. What happens in that 9 months could be devastating to that patient. Let that patient have the ability to preserve their fertility, get cured, be a happy parent.
Are you concerned about insurance rates for these folks in terms of maybe having to pay premiums that might be out of reach for them as well?
Well, again, in the economic studies that have been shown, the number of people we're talking about is small. The cost per patient spread over the policies is very insignificant, and the end cost savings for the insurers, treating people sooner saves them money in the long run.
How soon do you think we're going to get some kind of feedback, or how soon would you like to get it from the insurance companies to see if you can move forward?
I'm hoping they embrace this and they come forward sooner rather than later. Again, this is a loophole. This isn't a mandate.
All right. Assemblymember Anthony Portantino, very interesting indeed. Keep us posted on that. We want to thank you for being here. We want to thank you at home for watching Time Warner Cable's local edition, the Sacramento Report. Always remember, you can watch this interview as well as any others by just simply going to My Government On Demand, and you can get it on Channel 1. Make it a good one.